Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Specific antidepressants and you're looking at its adverse effects. So first we start off with the drug starting with A, that is the amitriptyline. Amitriptyline. So this amitriptyline, the side effects being it is involved with the sedation. So there is sedation, it is anti-muscarinic. Next is it is also associated with the hypotension. So there is hypertension, then there is arrhythmias and seizures. So there is presence of arrhythmias as well as the presence of the seizures. Next we move on to the fluoxetine, the drug that is fluoxetine. So fluoxetine is associated with the nausea, anorexia. So there is nausea, there is anorexia. Next is there's loss of libido, loss of the libido, and also it causes a insomnia. So insomnia is caused by the fluoxetine. Next we move on to the trazodone. So trazodone is it is a sedative. It is nothing but a sedative. It results in the priapism. So it is a sedative. It leads to the priapism as well as there is hypotension. Then we move on to the bupropion. So bupropion is nothing but there is presence of seizures. Next is mild tachycardia. Then comes the presence of the HTN, that is the hypertension. Then you look at the mirtazapine. The mirtazapine is a sedative. It has increased appetite, increased positive appetite, and there is also presence of the weight gain. So mirtazapine associated with weight gain, it is a sedative. To learn and grow daily like this, please do subscribe.